I'm back. Good evening, everyone. This is the Doty Report on Comprehensive Health. Happy Tuesday. Thank you so much for tuning in today and being a part of the show. I am always excited and always feeling honored to be the host of this show. The Doty Report is about health education. We talk about everything related to our health, physically, mentally, spiritually, even financially, addressing some of the issues that we know affect our community and the overall health of our community. So it is just important, even for me, to be able to bring to you information, relevant information, resources, any and everything that could possibly help you, your loved ones, your household, your neighborhood, your community live a happier, healthier life. Today, we are going to be talking about hepatitis C. And hepatitis, well, we're going to learn about hepatitis, but I want to, as I always do, give a shout out to the founder and CEO of the Georgia Doty Comprehensive Health Organization, Mr. Don Doty, and his wife Joyce. And he's actually one of our guests. You're going to hear a little bit about his story and his experience with hepatitis C. So we got a lot of information. Today we have three phenomenal guests. I don't want to prolong it, so I am going to bring on our first guest. Her name is Hannah Brooks. She is a doctor of pharmacy. She is the senior medical science liaison at AbbVie U.S. Medical Affairs. And prior to that, she was a clinical pharmacy specialist for Northwestern. Hi, Anna.
Hey there, Yolanda. Thanks for having me on. It's an honor.
Oh my God, thank you. Thank you so very, very, very much. I'm so excited about the information that you are going to share. So let's get right to it. I know you have a presentation for us, so let's get to it.
All right, let's do it. I'll share my screen. Thank you.
Very excited. We don't often talk a lot about hepatitis C, but there are some things that we all should know and be aware of, because it's definitely something that is prevalent in our community, whether we know it or not. So go ahead, Anna. What you got for us?
Absolutely. All right. Can you see my screen okay?
I can.
Perfect. Well, thank you everyone for listening tonight, and it's an honor to be able to speak to you about a very common virus, hepatitis C. So tonight we're going to discuss a few facts about what is hepatitis C, and I'll be referring to it as Hep C, and what exactly this virus does to the liver. And then we'll discuss the tests that are needed to diagnose if you have hepatitis C. And then if you have it, what are your options for treatment? And then finally, after treatment, what are steps that you can take to staying hepatitis C free? So first off, what is hepatitis C? Mm-hmm. Like I said, it's a virus infection, and there are several different strains or genotypes of the virus. There's actually 6 different strains. The good news, though, is they can all be cured. So hepatitis C, it affects the liver, but it can actually affect other parts of the body and organs as well. And that's because this virus is in the blood. So if you think about it, the blood is going all around our body. So other organs are susceptible to this virus. But again, good news, the virus can be cured. So I mentioned the liver. So why is the liver important? Well, the liver is actually the largest internal organ in our bodies. It has many jobs to keep us healthy. I like to refer to the liver as a giant filter. So it removes toxins and waste from your body. It even makes proteins that we need so our blood clots properly. And the liver is also important in breaking down different medications and even alcohol. So how does this virus attack the liver? Well, when you get infected with hepatitis C, the virus goes into your liver and it uses actually part of your liver cells to replicate. So your liver has a lot of virus in it if you are infected with hepatitis C. So over time, this virus attacks your liver. And I say over time because this is not an overnight thing. Usually this is a period of about 20 to 30 years. So what happens initially is your liver gets infected with the virus. There's swelling, inflammation in your liver. And if that continues, it can even lead to scar tissue within your liver that's replacing your healthy liver tissue. And that can actually impede some blood flow in your liver. And then finally, if that process continues, we go to what we call end-stage liver disease or cirrhosis. And that's when your liver becomes very scarred and hardened, and it's not working properly. This, again, like I said, is over a period of 20 to 30 years, but there are several things that can actually speed up the liver damage. That's if a patient or someone you know is drinking a lot of alcohol, if they have HIV, if they have fatty liver disease, or have hepatitis B. So this slide asks the question, is hepatitis C serious? Yes, it is. Hepatitis C is a major cause of liver cancer, known as hepatocellular carcinoma. And hepatitis C cirrhosis, like we discussed in the previous slide, if that becomes severe, ultimately it will lead to liver failure, where your liver is not functioning properly. And at that point, there's not much left to do except hopefully get a liver transplant. But again, this virus attacks more than just the liver. So people are at an increased risk for certain types of skin disorders, even kidney disease, diabetes, depression, fatigue, and even certain types of blood cancers. So how do you get hepatitis C? I like to compare hepatitis C to HIV, very similar routes of transmission. So think blood. So when a person's blood comes into contact with infected blood, that's how you can get the virus. This can happen in different ways. A very common one is sharing needles or syringes or other drug equipment that is contaminated with blood. Also, getting tattoos or bodily piercings that have been done with contaminated needles. Sexual contact can happen as well. This is more rare, but it is common in the population of men that are having sex with men. And also, if a mother has hepatitis C and she gives birth, the virus sometimes can be transmitted to the child. Also, too, if someone got a blood transfusion or even an organ transplant before 1992, they could potentially have gotten the virus because before 1992, screening for hepatitis C in the blood supply was not happening. Now that is happening. This virus is relatively newer, and so before 1992, a lot of people were getting transfusions and didn't even know that they had the virus. Also, too, if you're a healthcare worker and you get a needle stick, you could potentially be at risk of getting hepatitis C as well. But the point here is it's less important on how you got it, but the question is, what do you do when you know that you have it? Also, too, there's some confusion on, if you use or share a glass with someone that has the virus, can you get it? And you cannot. So if you share knives, forks, spoons, glasses, that's not how the virus is transmitted. If you cough or sneeze on someone, that's not going to transmit the virus. Remember, first think of blood. So the question is, if you get infected, does the virus go away on its own, or do we actually need to treat a patient? So this is interesting. So if someone gets it, we call it the acute infection, and sometimes the immune system will be able to clear the virus on its own. so you don't need medication, which is great. But the majority of patients, you can see here about 75 to 85%, they go on to the chronic phase, and the only way to get rid of that is with treatment or medication. So the question is, how common is this virus? Well, it's very common. So on this slide, it shows us there's an estimated 2.3 million people living in the United States that have it. But the interesting thing is, up to half of the people are walking around and they don't even know that they have the virus.
Wow.
And the reason with that is because when you first get it, the majority of people don't have any symptoms. You start getting symptoms when your liver over time gets more and more unhealthy. That's when you see more symptoms come. So that's why screening is so important. But this slide shows some of the symptoms from hepatitis C. But they're very general symptoms. If you look at this, you could think, well, that's similar to other diseases, their symptoms. So that's why it's important that to get screened. So talking about screening, who should get screened? Well, the CDC just put out a new recommendation. So they recommend everyone 18 years and older to be screened for the virus at least once in their lifetime. More frequent testing is recommended if there is someone that we know is actively using or injecting drugs, or has HIV, or has recently been in jail or prison, or even on long-term dialysis, because all those things are potentially risk factors for getting the virus, so they might need to be screened more frequently. And finally, pregnant women. It's recommended that everyone that's pregnant to get screened as well. So how do you get screened? Well, the good news is it's a very simple blood test. So there's blood tests that we use to learn what type or strain or genotype of the virus do you have. We'll use blood tests too to see how, assess the status of liver damage, and even to check for other viral infections like hepatitis B. There are scans that can be done too to get more information about the health of the liver and kind of to see how much scarring is there. So how do you know if you have hepatitis C? Get tested. Step 1, that blood test. The first test will know, do you have an antibody, which means you have been exposed to the virus. But step 2 means that if that's detectable, you do have active virus replicating in your body and you will need treatment. And then assessing liver damage, there's this score called an F score or fibrosis score. And that's a score from F0 to F4. Well, F0 means your liver is healthy, there is no scarring. F4 means your liver is sick and there's extensive scarring and damage done. But the good news is there is treatment. And with these more recent treatments, previously a drug called interferon was used, and that was a shot given. And a lot of patients had side effects from that and also didn't like getting these injections. But the good news now is there are no more shots. The medications out today for treatment for hepatitis C, they're all oral. So it's just simply tablets that are taken daily for either 2 months or maybe even up to 3 months, kind of depending on what type of strain or genotype of the virus you would have. But so you complete medication, just pills for either 8 or 12 weeks. And the good news is greater than 90% of people are cured now.
That's great.
So some important things to think about if you are on or starting hepatitis C treatment. Like any medication, make sure to take it as directed every day at the same time. And tell your healthcare provider if you have other medical conditions. Also, too, if you've started any new medications, even vitamins or herbal supplements or over-the-counter medications. That's just because we don't want to make sure we want to mitigate any type of drug interaction. And then finally, make sure you get your blood test on time. So how do you know if you're cured? You'll complete treatment with the medication, and then 3 months from when you took your last dose of medication will check your blood. And at that point, if there is 0 virus detected in your blood, that equals a cure. Now, if you have we say a sicker liver, so if it has scarring or is cirrhotic, so that F3 or F4 fibrosis score we were talking about, at that point, we would still want to monitor you for liver cancer. So you would still want to be seeing a liver specialist just to make sure that we're screening every 6 months for hepatocellular carcinoma. Another thing to consider is after a patient is cured, you can get reinfected. So it's very important that you know the risk factors of getting the virus. Remember, think blood. So anytime you could come in contact with infected blood, you could get reinfected. And also, if you have the virus and haven't been treated yet, just be very aware of making sure you are not spreading the virus to someone else via infected blood. So in summary, Hep C is a very serious infection, but we can screen for it now, and there are treatments, and make sure, if you get treated and you get cured, that you make sure you don't get reinfected, and also, avoid trying to spread the virus to others, and remember how the virus is spread. And again, it's less important how you might have gotten it, but what you do about it now, because there are treatments out there. All right, so that is the end of my presentation, and I will.
Great information, and I know some of the things that you did cover during the presentation, but for the purpose of the viewers, I want to make sure that they have some understanding. So there is a cure for hepatitis C, correct? Can't hear me?
I think I'm not.
Can't hear me? I'm sorry. Why can't you hear me? Okay, so can you hear me now?
I think there's a.
We are talking, this is the Doty report on comprehensive health, and we are talking about hepatitis C. Hannah just gave us a great presentation about hepatitis C. So I have a couple of questions. She covered it in the presentation, but I want to bring on our next guest, William, and he is AKA Bill. He is a medical technologist. He's a former faculty of University of California in San Francisco. Bill, I am an alumni of the University of California in Irvine. So,
oh my goodness.
yay to the UC system.
Thank you.
And I see that you are the chairman of the California Hep C Task Force still. Is that correct?
Yeah, that's correct.
Okay.
Thank you so much for having me on. So thank you.
No, thank you so much. So first, let me give you a few minutes just to share a little bit more about yourself and the connection to why we have you a guest to talk about Hep C.
Well, this is a good follow-up to what Hannah was talking about, because I contracted hepatitis when I was 13.
Wow.
Through a medical procedure. And wow. I had an acute infection.
Oh, wow.
We're talking 1967. Okay.
Mm-hmm. Okay.
And 66, 67, and was hospitalized, going into liver failure. And they didn't call it hepatitis. They called it chronic persistent hepatitis. And I was in a Kaiser hospital, and after a couple of weeks with antibiotics, I was isolated. If anyone came in, they had to have fully clothed like a hazmat suit, and there was a big yellow sign on the door, so I was completely isolated, and they had a tent around me. So it was you were isolated because they knew it was highly contagious, but they didn't know
Okay.
all the reasons. And after a couple of weeks, certainly I improved and was sent home. But they told me I had now chronic liver disease. Well, they
Wow.
didn't have a name for it for several years,
Mm-hmm.
and I think about 5-6 years later, they started calling it non-A, non-B hepatitis
Mm-hmm.
because they had found out about hepatitis A and B, and
Mm-hmm.
that name stayed there for quite a few years until about 1980. Early 1980s, and then they started calling it hepatitis C. And then
Mm-hmm.
by, I believe it was 87, rather 87, they started to be able to identify it and formulated a test so that all the nation's blood supply could be
Mm-hmm.
tested at blood banks. So
Mm-hmm.
where people were donating blood, they could test that blood and determine whether or not it had hepatitis C. And in fact, one of the scientists involved with that, there were three scientists,
Mm-hmm.
actually many more involved, but three of them recently, just very recently, about 8-9 days ago, got the Nobel Prize in medicine. So
Mm.
this was after over 30 years
Wow.
to finally get the Nobel Prize. They had won some other prizes called the Lasker Prize, but this was the Lasker Award. But the Nobel Prize in medicine is really the highest you can get. So that was
I'm
a
gonna
big win. We're all excited about that. So
let me stop you
yeah,
for 1 second because I
sure,
was told that you
yeah,
received the Georgia Doty Health Pioneer of the Year award at some point. Is that correct?
that's correct. 2 different years, 2 different years. I have them.
Okay.
I have them right here in my office. Yes,
Nice.
thank you.
Nice. I
Yes,
just
thank
wanted
you,
to acknowledge your achievements as well.
thank you, thank you. Well, um, just as the story goes, to kind of shorten it a bit, I was unable to be treated, and in
Mm-hmm.
1995, I was referred for transplantation
Mm-hmm.
because at that point they said it was so advanced that even the early treatments they were starting to develop at that time, they said would kill me. They would, because
Mm.
I had very low platelets. So I waited. I did a number of tests and waited for a suitable liver. And in late 1997, I was
Mm-hmm.
hospitalized. I think it was either late November, early December.
Mm-hmm.
And on January 5th of 1998, uh, a liver was available and I had my transplant.
Oh wow.
And that
Nice.
was my first liver transplant. I actually ended up having another one some
Mm-hmm.
years later after, so 13 months after the transplant. I then started the interferon combination therapies.
Mm-hmm.
And these lasted 48 weeks. I did them 6 times, 3 of them just the regular combination therapy, and then 3 years I did something called pegylated interferon,
Mm-hmm.
which was a more effective formulation that that would get to the virus in a far better way. And so after those years, it was found my liver was failing because the hepatitis C virus was so aggressive that even
Wow.
those treatments were not able to stop it. And
Wow.
so I had another liver transplant,
Mm.
and that was a very difficult one because I had some complications and so forth, but I survived. I'm still here. And after a long rehabilitation and hospitalization, I got better, and then several years later, so that was 2007. So fast forward to 2016, the direct-acting antivirals now had a protocol for liver transplant patients. I did the treatment, and within 12 weeks, my disease was gone.
Wow.
And then they did another test 6 months later to confirm it. And I was then I was then cleared of the virus completely after that 6 months test. So having had it for over 50 years, I came through it. I nearly lost my life. And during many of these years, I was actually continuing to work as an advocate, and actually working while I was on the transplant list. So it's, it was amazing to really get that second chance. Not just one chance, but twice.
Right.
So I'm forever grateful to the wonderful team I had at the university, and my family, my friends, everyone that came and donated a lot of blood, because these surgeries, they require having a lot of blood on hand.
Right.
And so it was really amazing. My family and community came together, and so I can't tell you how grateful I am for all that, because I've been able to see my children grow up, become adults, have children, and I'm a grandfather now. So
right. So I want to ask a few questions. If we can bring Hannah back on as well.
Sure.
I want to make it relevant to the community, and some of this Hannah did share in her presentation. So I want the viewers to know, though, like, why is it important for us to know about hepatitis C? Like, what's the impact that it has on communities? Is it affecting? I'm throwing a few things out there for discussion. Is it affecting primarily minority communities, urban communities? Why is it important for us to know about Hep C?
Absolutely. I think, Bill, do you want me to jump in first?
Yeah, go ahead. Go ahead.
Okay. All right. Nice to hear you guys. I don't know what happened with my audio. I'm sorry. But I think it's so important, right? Because what we're seeing now is, like I was showing you, there's a majority of patients that don't even know they have it.
Right.
And we're seeing that in certain populations, specifically now, these more younger patients, right, that are kind of part of this opioid epidemic. We are seeing a correlation of Hep C increasing with the opioid epidemic. So that's actually part of the reason the CDC changed their screening recommendation. Instead of the baby boomers 1945 to 1965, they recommend going down to 18 years old to catch these younger patients that have the virus. And it's important to get tested and screened, because if you catch these patients when they're younger, just like Bill was saying, right? I mean, this is a progressive disease. And if you can treat it early, you prevent that whole progression of liver damage.
Right. So, and I've been talking about different diseases and disorders, and trying to make the connection between preventive health and our primary healthcare provider. So if I go for a regular physical, of course, they do blood work. Are they screening for Hep C, or is that something that I have to ask for?
I think that depends on your provider. What we're seeing right now, if you go to hepatologist, right, a liver doctor, they're going to be all over that. But now we're seeing that there's different providers that are treating the virus. So if if you go to family medicine or a primary care practitioner, they are starting to treat now. But I always recommend, be your own advocate. They might be testing for it or they might not, but it's a simple thing that they can add on to the rest of your blood work. So it's not like an additional burden for you, as a patient. If you go in, they can add it to the rest of your labs.
So share a little bit more about, or just reshare, I should say, about some of the symptoms. Because I know I also heard, and I've heard people say you may not have symptoms, but what are some symptoms that may occur that may make me say, like, okay, maybe I need a Hep C screening?
Well, let me jump in here, and because
right?
I know. So with these symptoms, and it will vary from person to person. It's not necessarily that everyone will have all these symptoms, but they may have digestive issues, they may have fatigue, they may have soreness and tightness at this section on the right side at at their abdomen, down towards the bottom of their belly where the liver is, and they will, if they might feel various sensations, but they may have cramps. They may have, depending on the severity of their symptoms, they may have encephalopathy where they feel confused, and this is when you have more advanced liver disease, and they may have problems keeping their food down. There's all kinds, and sometimes they may have no symptoms at all. So it may take a number of years before they actually feel some symptoms. And if they have an acute infection, which is a smaller percentage of people once they've been exposed, it may occur within a few weeks or maybe even a month after exposure, where they have an acute infection, then that will be sensed by the tests, because it's very likely they'll see a doctor or maybe even go into an ER, and the blood tests will reveal that there is something wrong with the liver.
Okay. So I have to ask, and then we're going to bring on our next guest so he can share some of his stories, and definitely want you guys to stay around and so we can have a little more conversation. So if you have hepatitis C, are you have greater risk of getting COVID? Or if you get COVID, will you get like a worse case of COVID, or will you not be able to fight it as much if you did not have hepatitis C?
Let me just talk a little bit about a person's immune system. When a person has a virus like hepatitis C, their body is having to fight that, and therefore your immune system is compromised. So when you have a compromised immune system, because your immune system is working overtime trying to keep that condition at bay, trying to keep that virus at bay from taking over and destroying your body or your liver. So if you end up getting another illness, COVID, meningitis, something else, it's going to be more severe than it might otherwise be, because your immune system, it's very likely because your immune system is working to combat an existing condition, that it'll be more severe.
Yeah, and I was just going to add to that. It's a good question, right? I mean, we're in this pandemic right now. So the American Association for the Study of Liver Diseases, the American Liver Disease Guidelines, they actually published a consensus statement. And this question was asked, right? So if you have a patient, or if you have hepatitis C and we're in a pandemic, should you get treated now? Should you wait? And what they recommended was, if you know, COVID is not a contraindication to getting treated. However, they did say, if, let's say I have hepatitis C and I come down with COVID, does it make sense to start Hep C treatment right now? Well, in that case, per the guidelines, they recommend, right, take care of the COVID first and then treat the hepatitis C. But it's an interesting question too, and there was actually 2 international databases looking at this, one in the US and one in Europe, trying to generate more data of patients that have advanced liver disease, whether that's cirrhosis or hepatitis C or hepatitis B, and that had gotten COVID, and to see, how do they do long term. So it's a great question, and I'll say the data it's coming out every day. So stay tuned.
Okay, I got kicked out, but I'm back. You know what's going on today. So I want to bring Don Doty on, and I would love to. Don is the founder and CEO of Georgia Doty Comprehensive Health. I know that he lived with hepatitis C for a time, and has been one of his well, I'm trying to tell his story. Let me let him tell his own story. So what you got for us, Mr. Doty? What you want to share today?
Well, I want to bring to attention how many veterans got infected with hepatitis C. Back in Vietnam in the 60s up to about the 1972, the infected air gun that was given to us before we went overseas to Vietnam was infected. And it was substantiated by the Veterans Administration that it was infected. And a lot of guys got hepatitis from the air gun at that time in 67 before I went over. I didn't know until about 10, 15 years later, to an extent that I still had Hep C, and I did that by trying to donate blood to charity. And I found out that I had hepatitis. When I first came to Chicago, it was to set up and establish a trade school. Hepatitis was not in the picture of my vision, my dream, my goals. But when I found out that I had it and how I got it, it became one of our branding for our organization for many years. And we received a 5 or 6 year grant to go into IDOC to deal with some of the inmates that are there that were highly infected with hepatitis based on tattooing and drug use. And so that's what clearly gave us a national branding throughout the state here in Minnesota and also in California. Hepatitis C is something that you don't really have symptoms. I didn't have any symptoms. I had tiredness, a little achy in the back, but I didn't have any physical symptoms. And I think that really offered me the opportunity to really educate others in regards. And I think Bill received the Georgia Doty Award because of his achievement in California. And I really admire some of the stories in the books and the articles that he has written on hepatitis. So I'm really supportive of his support. Oh, wow, I didn't know you still had that picture. Yes. And we received 4 state proclamations here in Minnesota, one in Minnesota and 4 here in Illinois, and 1 resolution there in Los Angeles for our effectiveness. We're now going to establish a chapter in LA, Vegas, and Atlanta, Georgia, so that we can spread the word and create a more national initiative. Because of the COVID-19, people have forgotten the importance of HIV and hepatitis and other illnesses that are also affecting many minorities and many those that are coming out of prison that are at risk. So this is kind of like my legacy now to carry on and hope that I can establish something that can go beyond myself. And I'm cured now, but by being cured after so many years of having it, I have liver cirrhosis, which I was listening to Bill and listening to Hannah discuss about liver cirrhosis. There's no medication, there's no treatment, there's no follow-up to being careful of what you eat and maybe change your diet, but there's not much symptoms that you can get from having it.
We want to share a little video clip that kind of captured your story.
Oh, that was. I was diagnosed with hepatitis back in about 1994, working for an insurance company. And I had just donated some blood to a blood drive. And I got a phone call saying, hey, your blood was not accepted and that you had hepatitis C. My job as director of marketing, we went by a policy of trying to educate our sales staff to avoid people that are pregnant, to avoid people with HIV, to avoid people with hepatitis. 3 months later, after the policy announcement, that I didn't find out that I had hepatitis. I had a strong struggle for about a couple months to decide to come out and say that I had it, to deal with it, and to talk to the administration about changing the policies for hepatitis C specifically, and they weren't going to change the policy. So I resigned. I decided to set up a nonprofit organization that dealt directly with creating awareness for hepatitis C and to provide services and quality health care. After I was diagnosed with hepatitis, I had to go through some research to figure out how I came across hepatitis. And I determined that during the inoculation and joining the Marine Corps, that they used the same air gun on everybody, and that blood would be retained onto the air gun as they shot different guys in line. And I feel that this is where most of the guys in the Vietnam War got hepatitis C. There was a sense of fatigue, tiredness, but there was no physical symptom that I was aware of until I was notified that I had hepatitis C. And then all of a sudden you begin to feel more fatigued, but that kind of comes on after you've been notified that you had the disease itself. Family is the strongest support system one has, and I was very blessed by having a wife that was a loving wife, and herself being an educator, be able to learn and go with me to the VA and sit through the explanations from the doctors about the disease. I think that once you deal with the understanding of the disease, you can overcome some of the obstacles that it has. And that's how I kind of overcome my problem, is to be able to share that information with others.
Oh. Amazing story. Man, amazing story. Amazing story. Outside of you having it yourself and experience it, why is it so important? Why do you continue to just share your story with the community? Why is that so important to you?
I guess it's because a lack of education. Mm-hmm. A lot of people are not educated and informed. Mm-hmm. Resources are limited. It's something that maybe people felt ashamed of. Mm-hmm. When I went into the prisons, it really touched me then, because there were so many guys coming out mm-hmm. with hepatitis. Mm-hmm. I didn't know it until I collaborated with the Chicago Department of Health, mm-hmm. and they had a truck that came in upon their graduation from my program and made sure that everybody was tested or vaccinated. I think that health education is something that is not about the money. I think it's more into what you can give to help other people. And there was no one there that helped me other than other veterans. I had no idea about this illness, the disease, or having something like this. I don't know, I've always thought myself being very healthy. Mm-hmm. Like the virus, you don't know what's there out there that you're exposed to. But by knowing better, you can live better. And I think that that's something that I want to carry on. My program was health education, and this is part of my legacy.
Wow. Yeah. I definitely commend you and celebrate your efforts to be a health advocate for our community and be able to share your story and other stories and help us all understand the importance of being informed. You know, so I want to bring the other two guests back. This is the Doty report on comprehensive health. You just saw a video story that tells the story of Don Doty, who is the founder and CEO, and he's a Hep C survivor, right? I can say that, right? And Bill, you're a Hep C survivor, right?
Yes.
But I think it's important for people community people that are watching to understand that there is a cure. That screening, and Hannah, can you touch again on the importance of screening and what's that process? Because sometimes we're afraid because you think go get screened to go get tested, and we're like, I don't want to do that.
I know. Yeah, absolutely. I mean, the screening test right now, it's just most of them, it's just a simple finger prick test. So it's very non-invasive. And in most cases, that's it. Sometimes you have to do another blood draw to kind of look at some of the liver markers. Just like Dawn was saying, the health of your liver, whether or not you have cirrhosis or not. But I think I would encourage people, it's not to be intimidated by it. It's a very simple test. And the main thing is just identifying that you have it so you can get treated.
Right. And Bill, maybe you can share a little bit about, so if I find out that I have it, like what's next for me?
Well, I'd say the first thing a person should do is simply, if they have health insurance, to find out through their health insurance company who the providers are that will treat hepatitis C, and they can also just ask their primary care provider, and that person will provide them with a referral, and hopefully they won't have to jump over very many hurdles to get on treatment, depending on the system they're in and the state they're in, or the health insurance they have. So that's their first step. And I must say that just adding one thing to where Dawn and I have talked about this long road that we've both traveled. I think in the present and in the future right now, for people who are concerned whether they may have hepatitis C or have been newly diagnosed, to be sure to get current on their current vaccinations. Make sure they get their hepatitis A and B vaccine, get their flu vaccine, and once a vaccine comes out for COVID, to get the COVID vaccines when they're available. It's very, very important to get all you can to boost your immune system, and of course do what you have to do to get treatment or deal with cancer or transplant or whatever the issue might be as well. So that's the message I have.
So I know some of the I talked about, Hannah, in your presentation, some of the ways that you can contract it, and thinking about just like the community and the city and young people. You talked about tattoos. Is there things that you can share that we need to be aware, those who are maybe getting tattoos, or tips that you can provide, that will decrease the risk of contracting Hep C, if at all possible?
Yeah, I think the big thing would be, if someone's engaging in using different illicit substances, whether that's snorting or injecting, making sure that whatever drug equipment they're using is not contaminated. And there's so many resources now, and even getting a needle that has not been used before, or if someone goes to get a piercing or a tattoo, just simply asking the tattooer, is this needle, is it sterile? Because they have the right to ask that. So just simple things to think about, like anytime you could come in contact with infected blood, just be aware.
Right.
And then too, if you're not sure if someone has it, and don't share a razor or nail clippers or things where there could be residual blood on there.
Right. You said something, I think, that's so important. Just ask. I mean, not
Yeah,
being afraid to ask the question. It's your
right.
life. It's your health.
Yeah, absolutely. It's like
And
be your own advocate, right?
be your own advocate. I think it's so important. Um, this is the Doty Report on Comprehensive Health. We have been talking about hepatitis C. The great thing about hepatitis C is there is a cure, but you know you could live with it for years and not know that you have it. So that's why it's so important. And my understanding is that you get screened. There are some symptoms you may not have some.
Who are you speaking to?
This is just, I think I'm back. I got kicked out again. So we are getting close to our hour. So I want to give each one of you an opportunity to share some final words. And I'll start with Bill, with the viewers. What are some final words that you could share with those that are watching this evening?
Well, first of all, as difficult as it might get, don't give up. Keep a target on your dream and your goals to get treated and to get cured. Keep yourself busy. Keep yourself active, and keep your mind clear and and positive about the path that you have to take to overcome this. Remember, you can get cured of this disease in 8 to
And
12 weeks,
wow,
and that is amazing considering the treatments and the things that people have had to go through in the past before these developments came to be. So having to, it's not years of treatments, it's weeks. And there are the wonderful thing is there's really little to no side effects whatsoever in the current treatments. It's really amazing
wow,
to actually have a disease where there's a cure.
right, right.
I have other conditions where we don't have a cure, and so I'm still I'm still amazed by it.
Wow. Thank you so much for being a guest. Thanks for sharing your story and thanks for sharing your expertise. I really, really appreciate it. Absolutely. And definitely good luck to you. So, Hannah, I want to bring Hannah back and allow you, Hannah, to share some final words with myself and the viewers.
Sure. Well, first off, thank you for the opportunity. And I think, secondly, for people listening, don't be intimidated by this. The first step is just to go to your primary care, family medicine, or any health practitioner that you work with and get screened. That's step one. So don't have fear and anxiety, just get screened. And then if you are positive, don't despair, because just like Bill was saying, for the medications right now, the main side effects are fatigue, headache, and nausea.
Okay.
And most people that don't have hepatitis C probably have that anyways. If you don't have your cup of coffee in the morning, I have fatigue.
Right.
So be encouraged. And the durations of therapy, anywhere from 2 to 3 months. So get screened. And then if you are positive, get cured, because in the long run, you're helping yourself. You're preventing complications. You're preventing your liver from progressing to end-stage liver disease. So just be your own advocate.
Love that. Thank you, Hannah, so much. Thank you so much for the presentation and all the information that you shared. And last but not least, the man himself, Mr. Don Doty. What are your final words to our viewers who are watching this evening?
I think that I think most of everything has been covered. I just want to give a shout out and support. Appreciate the support from AbbVie right now. I think right now we can reach out to the various barbershops where people are using the same razors on everybody's head that has an infectious rate. We can reach the tattoo shops and put up information and things there to educate them also. The nail shops and the beauty shops, when they use your clips for your nails, to make sure that they're sterilized right out of the machine itself. So there's so many targeted areas that are putting people at risk, that now with AbbVie support, we can reach a larger group of folks in the underserved population at the same time. And I think that now also on a national scale, as we duplicate our programs in those other 3 cities I mentioned, I'd like to collaborate with Hannah and with Bill in terms of being part of that initiative as we go national and continue the success we've had here in Illinois.
Awesome. Thank you, Mr. Doty. We so appreciate you and all your work and your organization. If you would like to learn more about the organization, please go to georgiadotyhealth.org. The organization is always looking for volunteers, always in need of sponsors and donations, truly out doing the footwork. Organization that's been around a long time, but still making a grassroots effort to make sure that the community is well informed. We have been talking about hepatitis C. The great thing about hepatitis C is that there is a cure. All of them encourage you to get screened, get tested. And if for some reason that you are have hepatitis C, to be encouraged, because there is a cure. Thank you so much for tuning in to the Georgia Doty, the Doty Report on Comprehensive Health. I am Yolanda Gibbons. I have been your host. As always, it is an honor. I do hope that we have provided some information that is vital to your life or to someone you know. But what I will say, be informed, be healthy. This organization is doing all that it can to get the information out there and connect all of us to resources that will help us live healthier lifestyle. Again, thank all my guests. Thank Georgia Doty Comprehensive Health. And I just want to remind you guys to like the show, share the show, watch it again, tell someone about the show. And make sure that you vote if you haven't already. November 3rd is fast approaching. I want to encourage everyone to get out there and exercise their right to vote. Thank you and have a great rest of the week.